Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be answering some of your questions about braces we've received on our channel. So if you haven't yet, make sure to subscribe, tap the notification bell. We release braces related videos each week. So let's jump right in here. I've begun the same journey with my orthodontist 2 months ago. Severe open bite, like 7 or 8 millimeters. He told me basically the same things, but this video helps me understand better the tooth movement. May I ask you, are some risks to end with a gummy smile at the end of treatment? So again, thanks for the comments. I'm glad that you find this video helpful. So open bite treatment, your teeth begin where they're not quite touching the front. And over time, we will be pulling those teeth together. And that's usually through a combination of intruding the back teeth and pulling the front teeth down. A lot of factors go into a gummy smile. So one of them is your jaw and skeleton structure. If your jaws tend to diverge, you will have a tendency to have more of a gummy smile. If you have a high lip line where your lip is just very short on the top, you'll have a more tendency to have a gummy smile. If you have a hyperactive lip muscle that when you smile, it pulls your lips really high, that can cause a gummy smile. So again, depending on where you fit in that category, if you don't have a high lip line, if you don't have a high hyperactive musculature in your lip, if your jaw structure is normal, you probably don't have a lot of risk for a gummy smile. If you have any of those factors and you're correcting the open bite by pulling the front teeth together, you definitely may get some more of a gummy smile. So patients that fit into that category where they're at high risk for a gummy smile, that is one that maybe jaw surgery might be a better option rather than trying to do rubber bands to pull the front teeth together. So again, there's lots of things to take in consideration. I would definitely trust your orthodontist's judgment. Ask them these specific questions about your case, and they can see if it is something that you need to worry about. But I'd say most of the time, 99% of the time, we can fix open bites without any major gummy smile issues. Again, it might be different based on each person's case, but in general, probably not something to worry about, but ask your doctor for specifically about your treatment. All right, next question. When do you determine when surgery is needed for overbite? So the biggest thing with surgery is we have to determine, do we need to change the teeth or do we want to change the face? If we're wanting to change the face at all, usually surgery is recommended. So in a patient with an overbite, if they have a very retrusive lower jaw, then their best treatment option would probably be to do a surgery to move that lower jaw forward. So we can't move the jaw without doing surgery generally. In a young growing patient, we can do some things to help redirect growth, but usually to get a dramatic facial change, we would need to do surgery. So if someone's lower jaw is at a good position, but their front teeth stick really far forward, in that case, probably doing something like extractions on the top to pull those teeth back will give us the best result. So again, it's all dependent on where they start with treatment, where their jaws are, where their teeth are, and what's going to give us the best result when we're done. So it's hard to tell specifically in your case, but ask your doctor, and they can definitely recommend the best treatment option for you. All right, hello sir, I have one teeth which is behind my two tooth and other tooth. Those which are visible when I smile, not those that are back as slightly turned. Can you please answer how much time it will take to be perfect? I'm 21 years old. I know there's no age limit, but what is the prerequisite for having braces? So we'll just try to decipher here. I know there's sometimes a little bit of a language barrier, but that's fine. So it sounds like there's some teeth that are kind of blocked out behind the other teeth. So I'm guessing it's probably one of the front incisors, and then you have like probably a crossbite or some teeth blocked out, so maybe some of the incisors are pushed back behind the other teeth. So if that is the case, if I'm interpreting this properly, I would say it's probably going to be an 18 to 24 month case. So if you read a lot of our comments, everyone who asks how long does this take, most of the time the answer is 18 to 24 months, because that's usually just how long braces take in order for everything to be fixed correctly. So there are cases that are very simple that might be a year or less. Really complex cases might take up to 2 years. Though the way you're describing your teeth, I would say it's kind of just an average orthodontic case. If it's crowding with some teeth that are blocked out, that should be pretty straightforward treatment, probably a year and a half to 2 years. At age 21, your teeth are going to move just as quick as a teenager. That's really not an issue. The only time age really comes into play is once we get into our 40s, 50s, 60s. Teeth tend to slow down a lot. If you get your teeth done prior to that, teeth move pretty quickly in early adulthood, teenage years, and young children. It's really not an issue. So 21, it's going to be as if you were a teenager, your teeth will move fine. And as far as your specific treatment, without seeing your teeth, I can't say for sure, but based on how you describe them, I'd say a year and a half to 2 years should get the job done, and it shouldn't be too big a deal. All right, my age is 36 years. I'm facing problem with misalignment, cavities for wisdom teeth, black gums, and impacted canines. I want to align teeth. Can I go for braces treatment at this age, or any other problems like movement of teeth difficult and strength of teeth reduced after braces treatment? Any problem in extraction of tooth? So we'll kind of go through these. We listed a lot of problems. So first, I have cavities and 4 wisdom teeth. So first and foremost, before we even talk about braces, cavities got to be fixed. So there's no reason to straighten your teeth if they are decaying. We don't want to straighten teeth just to have you lose them. So before you even get into an orthodontic office, go see your dentist to get any cavities fixed and gum issues resolved. So if you have gum disease, that needs to be fixed. If you have cavities, that needs to be fixed. So based on your comments, I believe it said I have black gums. I assume that means you have some calculus or tartar buildup. That definitely needs to be resolved first. So again, braces is great, but it comes after the health of your teeth and mouth. If you have 4 wisdom teeth that are hurting you, those probably need to get taken out as well. Braces are probably going to be a great thing for you, but it may be down the road. I would say get into the dentist, get those cavities fixed, gums evaluated, probably wisdom teeth out. And then once you're healthy and everything is good, go see the orthodontist for the next steps. Obviously, misalignment is something that braces fix pretty easily. If you have impacted canines, that's something that can also be fixed. I want to align my teeth. Can I go for braces treatment at this age? So again, 36, your teeth are going to move just fine. Sometimes impacted canines can be more difficult with age, but most likely that's not going to be too much of an issue. And as far as strength of the teeth after braces treatment, your teeth don't really get negatively affected by braces if your hygiene is really good. So times that your teeth may be affected is if your hygiene is not great and you have gum disease or cavities. Braces and tooth movement make those conditions worse. So again, that's why we have to have really good health before we do braces. Otherwise, braces will make those issues become even worse. So any problems in extractions of tooth, if you watched any of my videos, you'll know that 20% of all orthodontic patients get teeth extracted for braces. It's just something that's very common. If you go out and poll the population, probably 20% of anyone who's had braces had teeth taken out. They're all doing fine. It hasn't caused major cosmetic issues. It hasn't caused dental problems. It hasn't caused health issues. It's something we do all the time, every day in our practice. It's really not something to worry about. I'd be more worried with the cavities, wisdom teeth, and the gums issue. That's a bigger risk to everything you have going on with your dental health. So hopefully that was helpful. Again, go see your dentist, start this process. Braces are definitely something you can do as part of your long-term dental care, but we got a few things we got to take care of before we get there. All right, next question. Hi, question about the bone changing along with pulling teeth together. I had the tooth behind the bottom canine pulled to make space for crowded teeth and an underbite. My main problem, other than listed above, is bone loss from overbrushing to the tune of 3 to 4 millimeter loss. Do you think bone could potentially be improved as the teeth shift? All right, so kind of deciphering this question, I had a tooth behind the bottom canine pulled. So it sounds like you have a little bit of an underbite and you had crowded teeth on the bottom. So one treatment option that we may recommend is having one lower incisor, that's your lower front teeth, taken out. And then by doing that, we can pull those bottom teeth forward. So it sounds like that was the treatment plan recommended. But the main problem, other than listed above, is bone loss from overbrushing. So those who start with an underbite and those lower teeth are kind of sticking far forward and have a lot of crowding, you probably have really thin bone and gums on those lower front teeth. That is something that is fairly common amongst people with an underbite, is just not a lot of bone or gums overlying those incisors. So if you're a heavy brusher, that definitely can cause some erosion of those gums. And your treatment should definitely help with that by taking out a tooth and pulling those teeth back. It should put those teeth into a healthier position and hopefully encased in more bone. Bone is hard to get back once it's gone. The only way to really regrow bone is by doing some sort of bone graft surgery. So getting the teeth into a healthier position will probably help to reduce any further issues with the bone loss. But in order to get bone back, that is probably something that needs to be done by a periodontist, that is a gum surgeon. What they do is they'll actually graft bone and gums over top of any areas of bone loss. So that may or may not be needed in your case, depending on your age, the severity of bone loss, the risk profile for your teeth. That might be something that's not needed. If your teeth can be maintained in their position and be healthy, you might be just fine. If your doctor recommends that's something you should look into, a periodontist would be the best one to determine if a bone graft surgery is something necessary. That's usually more in the moderate to advanced cases of bone loss where they would consider that. If you're young, healthy, and take care of your teeth, most of the time you can maintain the bone and gums where they're at. So again, hopefully that's helpful. If you have any follow-up questions, make sure to ask them below. All right, so that's the last question for this video. If you found this video helpful, please give it a like. Make sure to subscribe, tap the notification bell to know when we release new videos. If you have any other questions about these topics, feel free to ask them in the comment section below, or feel free to ask them on our other videos. You may be featured in a future video. Thank you so much for watching. We'll talk to you soon.